So my hello to all the listeners here. As you can see the title of this video, in this video I'm introducing you to a new course started by AIIMS joint venture with eMedicoz app. So it is a master class for psychiatry residents. Most of the psychiatry residents who know me, they are knowing that I released a promo video of this course 5 months back, but after a lot of procrastinations, initially I planned to bring up a recorded video sessions that I'll record the lectures and share it with us on the app so that the residents can see. But after the suggestion and guidance by Dr. Sumer sir, our director AIIMS, he suggested me to conduct this course live, and I really like the idea. So here I am ready with the first module of the live course, that is child psychiatry. The purpose I have selected child psychiatry is it is a specialization in psychiatry. We all know we have DM degrees available in India and abroad. So some students are looking forward for some MCQ related things also for entrance exam. Moreover, many of the places OPD we do not see much of the cases of child psychiatry as much as we see adult in general psychiatry. And this is just the first module. I'll be bringing up you with entire psychiatry, new modules, de-addiction, all other modules eventually over the period of March. So for the first 2 months I have planned this child psychiatry module. This is a theory teaching, because I have seen that MD, DNB or DPM students, what is happening most of the time in residency, that one particular topic about which they are supposed to present. For example, in my MD days I was supposed to present ADHD, so I read ADHD nicely but I missed the other topics. But sometimes what happens, we read the important topics, ADHD, autism, whatever cases we see, but I didn't read communication disorders very properly, language disorders, okay, some minor topics like eliminations or something. I believe once a proper theory reading of textbook, either Kaplan synopsis or CTP, whatever you like, is must for understanding of all the topics required for a resident. So I'll be focusing on resident teaching theory topics, and this teaching is going to be proper handwritten. For the students of DAMS who know me, we will do a proper pen paper based teaching. No PPT, no PDF, because I believe when you are writing and when I am writing, you are more connected to the class rather than a presentation. I'm not keeping it as conventional teaching in the MD days like a PowerPoint presentation or a PDF showing. So we will do a proper pen paper teaching. I have uploaded 2 sample lectures also of this on the YouTube channel on disruptive mood dysregulation disorder and biology of ADHD. So you can see what I'm talking about for those who do not know about this pen paper teaching. Writing, I'll be writing, you'll be copying. So it is purely handwritten notes which will be a ready reckoner for you to refer anytime during your psychiatry practice, that this much about ADHD I should know, this much about autism I must know. We'll discuss it from a clinical approach based, okay, regarding the patient's perspective and the medication and the pharmacotherapy or psychotherapy, non-pharmacological intervention, whatever. Okay, so, and the next important thing with Dr. Sumer sir has suggested, and I really like the idea, it will be a live interactive teaching, so that the residents can ask me the doubts, you can respond, we can have a biofeedback. For example, if I'm teaching something and you say, sir, I haven't understood this, I can repeat it, okay, and if you are responding that yes, we have understood, or suppose I'm teaching X thing and you are thinking about it and a why doubt comes in your mind, so you can straightforward chat in that. So we have started this eMedicoz live teaching for MD MS aspirants this year, and now I want to introduce this for MD students, and you'll really like this because when residents are interacting with us, even we are learning. So I take this as a very good learning opportunity. So many residents, those who know me, they know that I was waiting for this chance to teach residents, and finally it has come after a long wait. Okay, so I'm really excited to talk to all of you. I have selected the slot as Friday evening because weekends, I'm supposed to be occupied for the other lectures, and selected for the time being 2 hours a week. So I suggest the residents to kindly manage the duties, and if you are joining this course with me, please join at 8:30 to 10:30 p.m. I have kept the evening hours so that your rounds and work are mostly over. My basic focus of teaching would be Kaplan synopsis based chapter with a few additions from CTP and Rutters. Okay, so this will be our base because this is the most important thing. The students were saying I can read this book myself also. Obviously you can, but along with me, if it will give you a routine, and we'll go chapter by chapter, word by word, page by page of Kaplan, and we'll be discussing how to cover this Okay, because I believe all chapters are important. You cannot say in MD that this chapter is important. After all, you're doing a post graduation in that subject, so you are supposed to know every chapter, every disease, and everything that's mentioned in this book. Okay, suppose you have a duty, then you can access the recorded lecture for up to 3 months of subscription. Okay, so this is the routine I have planned. For the time being, I have planned 8 Fridays for you, starting from 8th of January, 15 January, 22, 29, 5th January. This lecture is already pre-recorded, uploaded on the YouTube, but I'll put it in your course as well. Then 12th, 19, 26. So I have planned these 8 lectures. First lecture I am starting on 8th January. It will be intellectual disability, that is mental retardation, diagnosis and approach. Then communication disorder, autism, 2 lectures. Then ADHD, first lecture I have already taken biology, so diagnosis and approach we shall discuss. It's not hard and fast 2 hours. If I may need the feel, if I feel the need to extend it, I may extend it up to later also, because after 10:30 also we are not very busy in psychiatry. Usually, most of the times. For those who are, it's okay. You can watch recorded. Then SLD. SLD cases are not very likely in most of the general psychiatry OPD, specifically in mental hospital setups, but we need to know these cases. How do we have to approach tic disorder, Tourette, and the attachment disorders of the childhood. So I'm looking forward to see you all. Many of the students have already enrolled for this course. Okay, so in the comment section of this video, you'll see a link for enrolling for this course where you can directly enroll. There's a coupon code available also with which you can get a 10% discount. So looking forward to connect with you all residents. Thank you so much. That's all from my side.